Picture this. You're lying in bed, staring at the ceiling, unable to sleep because of an itch that just won't stop. You scratch until your skin feels raw, slather on every lotion in the house, and still, it's there, like a relentless whisper you can't ignore. For those over 60, this isn't just a nuisance. It could be your body sounding an alarm, a warning about cancer that's hiding in plain sight. As we age, our bodies speak in subtler ways. The aches, the fatigue, and yes, even the itches, they're not always just aging. Sometimes, they're your body's way of begging you to listen. In this deep dive, we're uncovering 5 specific itchy spots that could signal cancer, often months before other symptoms appear. These are random irritations. They're patterns doctors have seen in countless patients diagnosed with life-altering conditions like lymphoma, pancreatic cancer, breast cancer, and more. This isn't about scaring you. It's about arming you with knowledge. By the end, you'll know why these areas itch and what's happening beneath your skin, which cancers they're linked to, backed by science, how to spot the difference between a harmless itch and a red flag you must act on. For older adults, these quiet signals can be the difference between catching something early and facing a harder road. So, grab a cup of coffee, settle in, and let's explore this together. Your body's talking. Are you ready to listen? Spot 1. Persistent itching on your lower legs. A whisper of lymphoma? You're sitting in your favorite armchair, maybe watching the evening news, when it starts again, that maddening itch on your shins or calves. You rub, you scratch, you sigh. No rush, no dryness, no new soap or lotion to blame. It's just there. For many over 60, this isn't just old skin acting up. It could be a silent warning of blood-related cancers, especially lymphoma, which strikes over 80,000 Americans yearly, with 60% of cases in those over 60, American Cancer Society. Why the lower legs? Lymphoma begins in the lymphatic system, your body's unsung hero that fights infection and drains waste. When cancer cells multiply, they release inflammatory chemicals called cytokines into your bloodstream. These chemicals irritate nerve endings deep under your skin, triggering a deep, burning itch that feels like it's coming from inside. It's not the kind of itch that comes and goes. It lingers, worsens at night, and laughs in the face of your favorite moisturizer. Real story. George, a 75-year-old retired teacher from Ohio, lived with this itch for 6 months. He'd wake up scratching his legs until they were red, blaming everything from his detergent to the dry winter air. I thought it was just part of getting old, he shared at a cancer awareness event. His doctor prescribed eczema creams, but nothing worked. Finally, a routine blood test showed abnormal white blood cell counts. Scans revealed swollen lymph nodes in his chest, a clear sign of Hodgkin's lymphoma. That relentless itch? It was his body's first, desperate cry for help. The science behind it, studies in the Journal of Clinical Oncology, 2020, show that up to 30% of lymphoma patients experience itching as an early symptom, often in the lower limbs. This isn't surface-level irritation, it's your nerves reacting to chaos brewing within. As we age, our bodies become less obvious about distress. Pain might not show up. Lumps might hide deep inside. But your nerves? They're still on high alert, and an itch is often their first signal. What sets this itch apart? It's persistent. Think weeks, not days, resists lotions, and often pairs with other subtle clues. Night sweats that soak your sheets. Fatigue that lingers despite rest. Unexplained weight loss, 10 pounds or more without trying. What to do? If this sounds like you, don't dismiss it. Make an appointment with your doctor and say, I have an itch on my lower legs that won't go away. Can we run some blood work? A simple complete blood count, CBC, can spot abnormalities, and if needed, imaging like a CT scan can dig deeper. For older adults, you've lived long enough to know your body. If something feels off, trust that instinct. George ignored his itch for months, thinking it was trivial. But speaking up saved his life. His lymphoma was caught early, and he's now in remission, enjoying his grandkids' soccer games. Your body's whispering. Don't let it turn into a scream. Spot 2. Itching between your shoulder blades, a pancreatic cancer clue? There's an itch on your upper back right between your shoulder blades that feels like it's under your skin. You twist and turn, maybe ask your spouse to scratch it, but it's back by bedtime. It's tempting to blame a scratchy sweater, dry air, or that old office chair. But for some over 60, this specific itch is a chilling early sign of pancreatic cancer, one of the deadliest cancers, with a 5-year survival rate of just 12%. National Cancer Institute. Why the spot? The pancreas, tucked deep in your abdomen, helps digest food and regulate blood sugar. When a tumor grows, it can block bile ducts, tiny tubes that carry bile from your liver to your intestines. When bile backs up, salts build up in your bloodstream and irritate nerve endings, especially in the dense sensory network of your upper back. The result? A deep, relentless itch that no lotion or back scratcher can tame. Real story, Linda, a 70-year-old grandmother from Texas, called it her phantom itch. She'd wake up clawing at her back, frustrated and exhausted. She tried new mattresses, switched to hypoallergenic sheets, even visited a chiropractor. Nothing helped. It felt like it was coming from inside me, she said. During the routine checkup for fatigue, her doctor noticed elevated liver enzymes. An ultrasound revealed a small pancreatic tumor pressing on her bile duct. That itch was her only symptom for months. No pain, no jaundice, just a nagging sensation she couldn't shake. The science behind it: a 2019 study in pancreatology found that up to 20% of pancreatic cancer patients report itching as an early symptom, often in the upper back. This is especially true for tumors in the head of the pancreas, which obstruct bile flow early. For older adults, these subtle signs are easy to miss. We chalk them up to aging or minor irritations, but your body's wiser than that. What sets this itch apart? It's focused, persistent, and often comes with other clues. Darker urine, like iced tea. Pale, clay-colored stools. Unexplained fatigue or mild abdominal discomfort. What to do? If this itch sounds familiar, don't wait. Ask your doctor for a blood test to check liver function, like ALT and AST levels, and mention the back itch. An ultrasound or CT scan can check your pancreas and bile ducts. Early detection is rare with pancreatic cancer, but Linda's story proves it's possible. She's now undergoing treatment, grateful she spoke up about her small complaint. For older adults, you've spent decades caring for others, your kids, your spouse, your community. Now it's time to care for you. That itch might feel trivial, but it could be your body's way of saying, please notice me. Don't ignore it. Your loved ones need you around for years to come. Quick check-in. Is this hitting home? Drop a 2 in the comments to let us know you're with us. Share a story. Have you ever had a back itch that worried you? Spot 3. Itchy scalp with no flakes, a leukemia or skin cancer warning. Your scalp's tingling, crawling, burning. You run your fingers through your hair, expecting dandruff or redness, but there's nothing to see. For older adults, this isn't always a shampoo issue. It could be an early sign of leukemia or scalp skin cancer, conditions that affect over 60,000 Americans annually, with higher rates in those over 60, Leukemia and AMP, Lymphoma Society. Why the scalp? Leukemia, a cancer of the blood, causes abnormal white blood cells to multiply, triggering immune overactivity. This inflames nerves, especially in sensitive areas like the scalp, causing a deep, tingling itch that feels more like a sensation than surface dryness. Skin cancers, like basal cell carcinoma or melanoma, can also start as an itchy patch on the scalp, especially in areas with thinning hair exposed to years of sun. Real story: Henry, a 73-year-old retiree from Florida, noticed his scalp itching every afternoon. He blamed his baseball cap, then his shampoo, then the humid coastal air. He tried everything: anti-dandruff products, coconut oil, even going hat-free. The itch persisted. During the checkup for fatigue, His doctor ordered a blood panel, which showed sky-high white blood cell counts. A bone marrow biopsy confirmed chronic lymphocytic leukemia. "My scalp was trying to tell me something," Henry said, shaking his head. The science behind it. A 2021 study in Blood Advances found that itching, or pruritus, occurs in up to 25% of leukemia patients before diagnosis, often in the scalp or extremities. For skin cancers, the Journal of the American Academy of Dermatology, 2020, notes that persistent itching is a key early symptom of melanoma in older adults. As we age, our scalps become more vulnerable. Thinning hair and decades of sun exposure increase risk. What sets this itch apart? Feels like tingling or burning, not just dryness. Moves around or stays in one spot. Resists shampoos, oils, or moisturizers. May pair with fatigue, easy bruising, or frequent infections. What to do? If your scalp's been itching for weeks, see a doctor. Ask for a complete blood count to check for leukemia and a dermatologist exam for skin cancer. Have a spouse or hairdresser check your scalp for bumps, redness, or scaly patches, areas you can't see easily. Early detection can make all the difference. For older adults, you've earned every wrinkle and gray hair, but don't let normal aging silence your instincts. Henry's itch felt like a nuisance, but it led him to a diagnosis that's now managed with treatment. Your body's still fighting for you. Give it a fighting chance. Spot 4. Itching on your chest or breast. A subtle but urgent signal. An itch on your chest, around the nipple, under the breast, or near the collarbone feels like a minor irritation. Maybe it's a sweaty bra, a tight shirt, or thinning skin. But for men and women over 60, this could be a red flag for inflammatory breast cancer or lymphoma, both aggressive cancers that need early action. Why this area? Inflammatory breast cancer, which accounts for 1 to 5% of breast cancer cases, American Cancer Society, often starts with itching, warmth, or thickened skin before a lump forms. It's fast-moving and doesn't mimic a rash or infection. Lymphoma can also trigger itching from swollen lymph nodes in the chest or underarms, irritating nearby nerves. Real story. Ruth, a 69-year-old grandmother from California, noticed an itch on her right breast that wouldn't quit. She tried new detergents, looser clothing, even going braless. "I felt silly mentioning it," she said. But the itch persisted, and during a checkup, her doctor noticed slight skin dimpling. A mammogram and biopsy revealed a small, aggressive tumor near the surface, no lump, just an itch that saved her life. Ruth's now in remission, cherishing every moment with her family. The science behind it. A 2018 study in the Breast Journal found that itching is a presenting symptom in up to 15% of inflammatory breast cancer cases, often with no visible lump. For lymphoma, itching from lymph node involvement is well documented in older adults, Journal of Clinical Oncology, 2020. As we age, skin thinning and reduced immune surveillance make these areas more vulnerable. What sets this itch apart? It's localized, same spot every day. May feel warm, tight, or slightly rough. Does it respond to creams or lotions? May include swelling, heaviness, or lymph node tenderness. What to do? Don't wait, request a mammogram or ultrasound, and tell your doctor about the itch. For men, male breast cancer, though rare, often starts with similar symptoms. A lymph node exam or biopsy can rule out lymphoma. Early detection starts with noticing. For older adults, you've carried the weight of life's challenges. Now, don't carry the burden of doubt. Ruth's itch felt trivial, but it led to early treatment. Your body's signaling. Don't let it go unheard. Let's connect. Drop a 4 in the comments if this resonates. Have you ever had a chest itch that worried you? Share your story. We're listening. Spot 5. Itching in the anal or genital area. Break the silence. It's the topic we shy away from, an itch in the anal or genital area that's awkward and easy to ignore. You blame hygiene, toilet paper, or irritation, but when it lingers for weeks, it's time to stop dismissing it. For those over 60, this could signal anal, vulvar, or penile cancer, rare but rising risks as we age. Why here? These areas are rich in nerve endings, making them early warning zones for internal changes. Cancers in these regions often start with a raw, burning itch that resists creams, hygiene changes, or over-the-counter treatments. Real story: Eugene, a 76-year-old from Maine, thought his anal itch was hemorrhoids. For nearly a year, he tried creams, diet tweaks, and cold compresses. The itch persisted. Finally, a colorectal specialist performed a scope exam, finding an early-stage tumor in the anal canal. For women, vulvar cancer, though rare, often begins with a stubborn itch, sometimes with rough or discolored skin. The science behind it: a 2021 study in diseases of the colon and amp rectum notes that itching is a key early symptom in up to 25% of anal cancer cases. For vulvar cancer, the Gynecologic Oncology Journal 2020 reports similar findings, with itching as a primary complaint in older women. These areas are sensitive, amplifying early signals from nerves reacting to abnormal cell growth. What sets this itch apart? It's chronic, weeks or months. Feels raw, burning, or deep. Doesn't improve with hygiene or creams. May involve rough, discolored, or thinning skin. What to do? See a colorectal or gynecological specialist for an exam or biopsy. Don't let embarrassment stop you. Doctors see this often, and early detection saves lives. Eugene's tumor was caught early, and he's now back to his morning walks. For older adults, you faced tough conversations before. This one's worth having. Your body's begging for attention. Don't let shame silence it. Final thoughts. Your body's always talking. Listen closely. As you read this, your body's communicating through every ache, every twinge, every itch. For those over 60, these small signals can be the first whispers of something serious, like cancer. The 5 spots we've explored: lower legs, upper back, scalp, chest, and genital area, aren't random. They're where your body often sends its earliest cries for help. You don't need to live in fear. This is about empowerment. Trust your instincts. If an itch feels wrong, speak up. Ask for tests. Demand answers. Early detection starts with noticing the small things and refusing to ignore them. For older adults, you've lived a rich life, full of love, laughter, and lessons. You deserve to keep writing your story. That nagging itch might be your body saying, "I'm not done yet." Listen to it. Act on it. Your family, your friends, your future, they're all counting on you. Call to action. Have you ever had a stubborn itch that worried you? Share your story in the comments. What did you do, and what did you learn? Your experience could inspire someone else to act. Drop a number, 1 to 5, to tell us which section hit home. Like, subscribe, and hit the bell for more life-saving insights. Together, we can stay informed, empowered, and unstoppable. What's one step you'll take today to listen to your body? Share it below. Let's start a movement of awareness.